Hey there, viewers. Welcome to our channel. Have you ever heard of a condition where sunlight can be dangerous? Imagine not being able to step outside without extreme protection. Today, we're diving into a rare genetic disorder called Xeroderma Pigmentosum, or XP for short. This condition affects how the body handles sunlight, and it's more serious than you might think. So, let's explore XP together and learn about its causes, detection, and prevention. First, let's understand what Xeroderma Pigmentosum really is. XP is a genetic disorder that makes people extremely sensitive to ultraviolet light, or UV light. This sensitivity can lead to severe skin damage and a higher risk of skin cancer. But why does this happen? The root cause of XP lies in our genes. Normally, our bodies have genes that help repair DNA damage caused by UV light. In people with XP, these genes are mutated. This means their bodies can't fix the DNA damage from sunlight properly. There are different types of XP, each linked to specific gene mutations. The most common types are called XPA, XPB, XPC, and a few others. Each type affects the body's ability to repair DNA in slightly different ways. Now you might wonder, how do people get XP? XP is inherited in what's called an autosomal recessive manner. This means a person needs to inherit two copies of the mutated gene, one from each parent. It's more common in families where parents are related, as they might share similar genes. Detecting XP early is crucial for managing the condition. Parents and doctors should look out for certain signs in children. One major sign is extreme sensitivity to sunlight. A child with XP might get severe sunburns after just a short time outside. This can happen even on cloudy days. Another sign to watch for is early freckling. If a young child develops lots of freckles, especially on sun-exposed areas, it could be a red flag. Unusual changes in skin color or texture are also important to note. Some children with XP might develop dark spots or strange-looking skin lesions. Eye problems can be another indicator of XP. A child might be very sensitive to light or experience eye irritation easily. In some cases, cataracts or cloudy areas on the eye surface might develop. If parents or doctors suspect XP, what's the next step? A visit to a dermatologist or geneticist is crucial. These specialists can examine the child thoroughly and recommend genetic testing. This testing can confirm whether the child has XP and which type they have. Now let's talk about prevention strategies for people with XP. The main goal is to protect the skin and eyes from UV light as much as possible. This requires a combination of different approaches. First and foremost, sun protection is absolutely essential. People with XP need to use sunscreen with a very high SPF, usually 50 or higher. They should apply it generously to all exposed skin, even on cloudy days. But sunscreen alone isn't enough. Protective clothing is another crucial part of sun protection. This includes long-sleeved shirts, long pants, and wide-brimmed hats. Special UV protective sunglasses are also important to protect the eyes. Avoiding sun exposure altogether is often necessary for people with XP. This means staying indoors during the sunniest parts of the day, usually from 10 a.m. to 4 p.m. When indoors, it's important to use special window films or UV blocking materials. These can help minimize UV exposure even when inside homes or cars. Regular checkups with a dermatologist are crucial for people with XP. These visits help catch any skin changes or potential skin cancers early. Early detection can make a big difference in treatment outcomes. Education and awareness about XP are also important prevention strategies. Families affected by XP need to understand the condition and how to manage it. This knowledge can help reduce the stigma around XP and promote better understanding. Let's hear from some health professionals who work with XP patients. Dr. Sarah Mitchell, a dermatologist specializing in XP, emphasizes early diagnosis, and she says,
"Early diagnosis and preventive measures are crucial. Families need support and guidance to navigate this challenging condition."
Dr. James Lee, a geneticist, highlights the role of genetic counseling. He adds,
Genetic counseling is essential for families with a history of XP. Understanding the inheritance patterns can help families make informed decisions about having children.
Both doctors agree that a team approach is best for managing XP. This means dermatologists, geneticists, and other specialists working together. They can provide comprehensive care for people with XP and their families. It's also important to remember the psychological impact of XP. Living with this condition can be challenging and isolating. That's why psychological support is a crucial part of XP management. Counseling can help individuals and families cope with the daily challenges of XP. Research on XP is ongoing, and new treatments are being developed. While there's no cure yet, scientists are working hard to find better ways to manage the condition. Some promising areas include gene therapy and new types of sun protection. So, there you have it, a deep dive into Xeroderma pigmentosum. We've learned about its causes, how to spot it early, and ways to manage it. Remember, awareness and understanding are key when it comes to rare conditions like XP. If you found this video helpful, please give it a like and share it with others. Do you have any questions about XP? Leave them in the comments below. Thanks for watching, and we'll see you in the next video.